Would you like to work for a company that has an 800% growth curve in a single day? But for the record, no, for the camera, nobody put up their hand. Okay, so none of you are interested in working for a company that would grow that quickly? Okay, tough audience, it's Saturday morning. All right. Do you think you ever would be likely to work for a company that has an 800% growth in one day? No, okay, so everyone's a bit more engaged with that. Well, there is a company that actually has experienced that. You've probably heard of them because they've helped out with this conference, which is great. Uber. So, and if you haven't heard of Uber, talk to the person next to you because they probably came here on an Uber. So why did Uber have an 800% growth curve in a single day? Because of the taxi drivers. Taxi drivers don't like Uber very much. And in London, what happened was when Uber came to London, the taxi drivers were like, this sucks. So I know what we're going to do. We're going to protest. We're going to protest. We're going to drive our cars out into the road. We're going to block up traffic. Yeah, that'll help. Well, yeah, it didn't really. Because what happened, of course, Uber was so young then that not many people had heard of them. But everyone was pretty peeved that they were having trouble getting around London. I imagine London traffic is not that great at the best time, never probably very good. So when taxi drivers start blocking up the traffic, it gets worse. People get annoyed. Why are they protesting? What's Uber? I've never heard of Uber. All right, great. There's an alternative to a taxi service who's pissing me off right now. Click, I'm now using Uber. That's what happened. That's what happened. 800% growth in a single day. And that was a couple of years ago now. This is a bit more recent. This is happening all around the world. We have Uber here in Perth. So same thing. In Perth, the taxi drivers were like, we don't like Uber. And they are representing a threat to our business model, so we're going to protest. And they did the exact, they should read the newspaper, they would have learnt. But they didn't, and they thought they would do the same, and they blocked off traffic. And Uber had a 500% growth on that day. Thank you, taxi drivers of Perth. And in France, things got really heated to the point that there was a huge, there were riots, there's issues. So here's some other companies that are disrupting. Does anyone recognise, this will show my age, or yours maybe, up the top there's a little blue guy, blue face. Anyone recognise that? Napster, yes, there you go, cool. I wasn't sure, in an audience of 20-somethings, I was like, oh, this is probably too old of a reference, you guys aren't going to get it. Well, if you haven't heard of Napster, Napster back in the days, when you guys were all a lot younger, we had this thing called the internet. It had just been invented, and you had to connect via a modem. It was really slow. There was this thing called a dial tone. Anyway, your parents will tell you about it. But what happened is that this guy created Napster. And what Napster was a free online streaming service for music where you could share your music. So if you wanted to download a song, and it was the only place to do it at this stage, it was brand new. If you wanted to download a song, it'd take you about 20 minutes. That's providing that your dial-up connection didn't break. But about 20 minutes on a good day, and you could have access to music. So of course, what happened? The record industry, not happy with the Napster guy. So what did they do? They sued him. Went on for a while. They actually won. And so Napster, that's why you guys don't know of Napster now. But what happened was, what do you think would have happened? Because back then, Apple was a computer company. Apple made computers. And the only computers the only people that really bought Apples at that time were sort of graphic designers. That were beautiful machines for that. That was where Apple was at in those days. So what about if instead of the record companies saying, we don't like this guy, we're going to sue him, what about if one of them, just one, the executive at Sony, the executive at Virgin went, actually, I'm going to hire that guy. And he's young, he wouldn't know any better. I'm going to bring his IP into my company and I'm going to learn from him. Because the record companies didn't do that, they enabled an innovative company like Apple to completely disrupt the music industry. Completely disrupt the music industry. Who buys CDs anymore? Seriously, like you download them. That wouldn't necessarily have been the case, or it would have been a different business model. And Apple certainly wouldn't be as large as they are now if they didn't go into music, if they didn't have an opportunity to do that. So you know Uber, Airbnb, an accommodation one. Netflix, the guys up there, you would know of Netflix, probably many of you subscribe to Netflix. What you might not know is Netflix disrupted themselves. So they used to be a video store. There's this VHS tapes, might be before your day. Anyway, there was these things called tapes. You had pencils to sort of, wind them up. Anyway, you used to go and rent them at a video store. And anyway, that's where Netflix got started. And they had this vision. They knew where they wanted to be, but technology wasn't there yet. So what they decided to do is they went from a video store to a store that actually mailed you out DVDs. So you'd subscribe and you'd get your DVDs in the post. And then as soon as broadband became ubiquitous and the technology caught up with their plans, then they started online streaming of television. And seriously, who watches live TV these days? Very few people. I think my dad still does, but not many people do. They've disrupted themselves. They didn't go, well, I'm sorry, everyone needs to keep coming to the video store, people. I'm going to protest, I'm going to drive out my cars into the street. They didn't. They disrupted themselves. And this is where the economy is heading. It's called disintermediation, if you want to have an intellectual term, since we're at a university today. And what it effectively means is removing the middleman. So you as the consumer, it's much easier for you. If you want music, you can go direct to the source and you just hit download, you pay your money, easy. You don't have to don't have to get in a car, go to the store, buy something. This is where the economies are heading. So welcome to the future. I mean, I often think this is like so cool. My partner and I, we're pretty geeky, but at the same time we'll go, it's like we're living in the future, isn't it? Like all of the stuff that we used to talk about 10 years ago is now here. It's incredible. And all of you guys, you use this stuff. There would be no one in this audience that wouldn't have a smartphone. I'm sure a lot of you are tweeting right now. One of my heroes, Alan Kohler, he's the guy who does the economics on ABC News every night. It's a bit of a crush on him. Anyway, he wrote an article about digital disruption. And he said, and I thought this was really clever, and he said, can the deluge of disruption be stopped or even delayed? Short answer, no. Long answer, definitely not. So this is happening all around us. What's happening in healthcare? Anyone here have a pager? Yep, for the record, everyone's like, yeah, I've got a pager. All right, we'll come to pages in a minute. So these are not news for the group of guys like you who would know all of this stuff. Healthcare is unsustainable. There are news reports all the time. Healthcare is unsustainable. Health leaders agree Australian health system is unsustainable. The Grattan Institute has concern over the future sustainability of health funding. Unsustainable. Current health funding arrangements, unsustainable. In Australia in 2050, there's going to be 40 million people and a huge health budget. Unsustainable. We have to do more with less. This is not news. This is what we get told all the time. And for our friend in the US, I'm really sorry about your healthcare system. That graph is really bad if you're in America, but it's bad if you're everyone, because it's all going up. It's all going up. We also know that a lot of what happens in the practice of medicine is actually very, very wasteful. There's lots of nods in the audience. Shamefully wasteful when you consider our limited resources and how hard you as clinicians have to work. I think clinicians, if I get hit by a bus and I get rushed to a hospital, I want the doctors and nurses treating me to have been on a 4-hour shift. I want them awake, alert. I want them to have the information about me. That's not how it works though, is it? Not how it works at all. And so what happens in healthcare is a lot of our tests are not needed, or there's a lot of duplication in tests, and all of this stuff costs billions and billions of dollars. This is no laughing matter. It's very, very important. So this is sort of where I get to the point of all of this. What about if we say this, as this guy did? What about if we consider that we can have absolutely all the care we want and need? We just have to organise it better. Doesn't that make sense? I think this is fantastic. Donald Berwick is a big health informatician guy in the States, and he was running for governor, and he lost, unfortunately. But when I was researching what Don said recently, and I saw this, and I was like, what a great quote. And he said that in the race for governor because he was getting really frustrated that people weren't listening to him. And he's like, look, it's really not that hard. We can do this, but we just have to change the way the business of healthcare operates. If we're brave enough to do that, and I certainly believe that, we can have all the healthcare we want and need. So I'm from a field called health informatics. I actually trained as an occupational therapist. Any allied health people here? Woohoo, allied health, yay. Great. Usually if I say that to an audience, there might be one person. So it's great to see so many allied health people here too. So I trained as an OT, and but I was really interested in, actually the very first prac I went to, and I saw the state of medical records, and I was horrified, shocked. Anyway, it was really bad, as you guys know, and I just couldn't believe it. And so I started getting very interested in, well, why don't we use computers? Like, that sort of would make sense, wouldn't it? And no, well, all these years later, we still don't on a large scale use computers. And I still remember the day when I discovered this term when I was Googling stuff, health informatics, and I'm like, oh my God, that's me, that's my people, that's what I'm interested in. And health informatics is really about bringing the information of healthcare where it needs to be, which is in the clinicians' and the consumers' hands, in the format that makes basically health informatics should make all that computer tech and all the really hard stuff that goes into it invisible. Because you as a treating clinician and you as the patient yourself, you just need the information that you need when you need it. You shouldn't be having to rummage around. I mean, how many clinicians I speak to that say that the reason they get involved in health informatics is because they're sick to death of spending about 30% of their shift in a hospital running around the ward looking for stuff and looking for information. That is not why you train how many years at university to do, but that's the situation. So health informatics speaks the language of healthcare, and it speaks the language of IT, it speaks the language of management science and information science. It's a very broad discipline, and I completely am in love with it. So if you think we're like the corpus callosum of healthcare systems, so we bring the different worlds together and we try to be the bridge that helps them talk. If you're a complete geek, you might like this analogy instead, that we're like the babblefish of the healthcare world. So, and if you don't know Hitchhiker's Guide to the Galaxy, again, talk to someone else next to you, they probably do. So why is health informatics important? Because to err is human. I'm not going to delve into any of this stuff because you guys know it already, but we know our healthcare system is full of challenges. What are we going to do about these things? Just keep saying, well, yeah, it sucks, you know, or are we going to do what Elizabeth just told us to do and be advocates? And be advocates for our patients and be advocates for ourselves. There's a massive safety problem in healthcare. And this might be news to you, it might not, but I'm going to go through it even for those who it is not news to, because I think these statistics deserve repetition. They're really quite incredible. So if I said to you that I flew here today in Melbourne and there was this massive crash, by the way, if anyone hates planes, this is completely made up, don't worry, but this is just an analogy. So what about if I said that I arrived here today on a plane and oh my God, you wouldn't believe it, I just took this picture at the airport, there's this massive crash, everyone's dead. What are the chances, do you think, Sydney Airport would still be open now? Or actually, indeed, probably most airports in Australia. They would be closed down immediately because people would be outraged and horrified, as they have a right to be. And everyone would want to know what caused this accident. There's 416 people dead. What happened? We want to make sure our airlines are safe. That's what we would expect to happen. And there'd be an investigation. And that's if 416 people died in one crash. Well, this is how many people die in healthcare needlessly. In Australia, we're looking at about 14,000 people a year. That's 2 747 crashes every month. In the UK, they have more people. There's 44,000 people die needlessly in the healthcare system that we know of. That's 2 crashes every week. And in the US, not because their healthcare system is any worse or different than ours, just because, again, there's a lot more people, 98,000 people in the US. That's 235 crashes a year, or 2 crashes every 3 days. Now, these errors aren't the fault of individual clinicians. They're the fault of a system that doesn't support clinicians to do their job properly. And this is an article, this is actually quite old, this is from 2011, but I keep it in here because you hear the same stuff every day, every year, that medications kill more than cancer or heart attacks. And what you look at is diagnoses wrong, drugs wrong, and a lot of those problems happen at handover as well. So that the research has shown that where most of the communication failures happen in healthcare, it's during that handover process. But why would it happen? If you actually had, an informed system in front of you that could actually help you and had all your patient information that you needed to in a very easily designed system and format, those things wouldn't happen. Because in healthcare, it's incredibly information intensive. These exact numbers are not really important. It's just to show you that we have billions of complex healthcare transactions occurring every year. And how do we manage those? We manage them on bits of paper in siloed systems where the organisation, sometimes you're even within a large organisation and you don't speak to each other. I had a mole scan done a few years ago, and the woman at the doctor was nervous about a particular mole. And she's like, come back in 3 months, I want to look at that mole again. So I was like, all right, cool. Came back in 3 months. And I'm in there and she does her thing, and then she's like, it was a different doctor. And he, I think it was he this time. Anyway, and he's like, yeah, you're fine. I said, well, what about that mole on my back? Because I can't see it, but that was why I'm here, because the doctor said she was concerned about it. He's like, what mole? I'm like, it's in your computer, isn't it? Like, they do have a computer sitting on the desk. I'm like, isn't it in your computer? And he's like, oh, I'm sure it's fine. And he's like brushing me off, and I'm like, yeah, I don't know about that. So I said, well, can I just have a look at the records then? Because, like, which mole was it? And I just want to, anyway. And the doctor was, like, skirting around the issues, and then actually said to me, well, actually, I don't have access to your previous record. And I was like, what? I was here 3 months ago, the same clinic. They didn't have an internal network. I couldn't believe it. So the room that I was in had a computer, and it was different from the room next door that I was in 3 months ago, and they didn't even have a network in their own facility. I was astounded. And I'm like, okay, well, I'm going to wait, and you're going to go into that room. And it's like insane. Like, so, you know, why do we have these problems? These siloed, it is really insane. Sometimes I find when, you know, I meet taxi drivers or Uber drivers, usually, but, you know, people outside of healthcare field, and they ask me what I do, and I tell them, I feel like an idiot sometimes, because they're like, what do you mean it's like computers? It's like, doesn't everyone use them? And I'm like, yeah, not really in health. I know that sounds stupid, and you think that we would, but we don't, because we use this technology. We use technology that actually requires a TARDIS to go back in time and find this type of technology used in any other place, any other industry. Pages, my goodness. Fax machines, are you kidding me? Healthcare people, this is it. Yep, this is it, the high-tech world of healthcare. It's all paper, Post-it notes. Goodness gracious. Oh, yeah, so this is what happens when you manage things with paper. How can you possibly? So this is a chart that I borrowed from a friend, so thank you, Leonie. And I thought this was awesome. So, okay, so we've got this is the Royal Children's Hospital in Melbourne. So the black and white picture at the top, that's what the building used to look like. Then it got even better. Now it's like a campus. Building's awesome, right? In the theatre, that's what it used to look like. Then we got better infection control, and now it looks like this, and you'll see computer screens and those sort of things. The actual record keeping hasn't really changed. It's still completely illegible. I don't know what any of that says. Like, I mean, seriously. So we don't give doctors... There's my friend Terry Hannon, and it's a long quote, so I won't read the whole thing, but what he effectively says, and I'm sure you'll get copies of the slides, what Terry says is like, you know, clinicians, and I mean clinicians meaning all healthcare professionals, we have this false belief that we're practicing evidence-based medicine. We're doing the best we can, and everyone is doing the best they can, but how can we possibly do the best possible job we can as clinicians when we don't have the tools, appropriate tools, to manage the information of healthcare? I think it's quite unethical. And so just think about yourself. Take off your doctor and your OT and your nurse hats for a second. Think about yourself. Now, I'm in a room here with mostly young people, and hopefully you've been so far very lucky in your lives and you don't have a big healthcare record. But think about, I don't know, your parent. Do you have a sick child? Think about, you know, from a personal perspective, where is that information kept? Do you even know? My information is all over the place. I've moved a lot. Certainly not connected. It would be really tough. I had a friend of mine who got married to a guy. It was really fast. It was a bit of a shotgun wedding, but not for the reasons that they normally are. It was because her boyfriend graduated from his PhD and he got offered a job straight away. He's so awesome in the States. So they had 4 weeks to pack up their entire lives and move to the United States. And in the US, they don't get de facto relationships, so they got married as well. But she has a chronic condition, and a rare one. And so she went to her doctor. That was her first point of call. And was like, I need copies of all my information, please, because it'd be quite thick, and, you know, because I'm moving to the States in a month. And he refused to give it to her. And he said, and the only compromise he was willing to do was to say, look, when you go to the States and you get a new doctor, tell your doctor to contact me and I will fax them to him. Yeah, I know, it's crazy. Anyway, and you know, you can get your access, if you have a difficult clinician, you can do freedom of information and stuff. It's like, oh my goodness, again, what world are we living in? It's 2015, people, almost 2016. Okay, so slight change of tack here. How are we going for time? I'm all right? Okay. Every man and his dog, there we go, there's the dog reference. Every man and his dog wants to get into digital health. Everyone wants to do it. There's people here I know who are entrepreneurs as well. So is that a good thing? Should we at least be aware of it? I would certainly think so. So these are some of the headlines that when we talk about digital health. So in Silicon Valley, the home of innovation, and we know here locally, innovation is the key buzzword. It's all about innovation bingo right now. I'm sure a lot of you have turned it into drinking games. How often do we hear politicians talk about innovation, agile, disruption? This is all good. Could be a drinking game though. Anyway, then Silicon Valley, and I saw this headline, I was like, it says health informatics is one of the new mega trends. And I'm like, fantastic. That's exactly the sort of headline I want to see, considering I'm the CEO of the Health Informatics Society. And I read through it and I'm like, okay. So it's all about software. Software is about to eat healthcare. And I'm like, I don't really agree with that. And then there's other headlines. Do we need doctors or algorithms? This is some of the crazy stuff that is coming out of just the pure innovation world, not healthcare, where we have entrepreneurs and innovators actually with some awesome ideas, and I wish them all the best, but they're thinking that, well, actually, you know what, healthcare people, you don't use computers and you probably should. So let me, fix it. I'll build your computer, I'll build you some software and an app, and you can start using that and it'll fix all your problems. And then do we even need doctors anymore? Like, how disrespectful is that? And how unsophisticated in your knowledge about the value that healthcare practitioners bring. But will technology-confident technologist investors save healthcare? And this guy even says, the question is, of course, is whether this is outrageous arrogance or is it just what our healthcare system needs? Bit John Oliver style, slap punch. I can't believe I had to follow a John Oliver clip. Thanks, Elizabeth. He's so awesome. We also have large companies you've probably heard of, like Google and Apple, who are making plays for healthcare. Now, at the moment, most of what they're doing is sort of behind doors, but I can tell you in the States, they are snapping up health informaticians. They're snapping up clinicians who know about innovation, clinicians who know about technology, clinical informaticians, and they're getting them to go work in these large corporations. And this is a really cool book. If this stuff is of interest to you, you might be interested in this book, where this guy talks about that, while digital disruption and innovation is incredibly important, we do want to make change. And man, are we desperately in need of change in healthcare. But we can't actually get to where we want to be, which is all about improved patient outcomes, all about improving things for clinicians, improving things, if we just install computers. It's not going to help. Because the future of healthcare has to be transformed models of care. It's the only way we're going to get to a healthcare system that we can all be proud of. So digitalisation of our healthcare information, imagine if we could do that in real time. Imagine that. How that would change things. But to make these changes happen, every single institution in healthcare is going to have to rewrite their business plans. So if you're thinking of a career in private practice, if you're thinking of a career in a hospital or a large organisation, I personally hope that by the time you're ready to retire, if not in the next 5 years would be nice, but it might take longer, that healthcare will work very differently. Because if we don't start organising the information of healthcare better, we won't have a healthcare system that is as good as we have it now. But that takes a brave government, because our healthcare system is obviously very government controlled, which is a good thing, but that's brave. How do you change the healthcare model? How do you change the way people are paid and compensated in healthcare? How do you increase the empowerment of consumers and as well, and to be a real relationship between the clinician and the consumer? I'm just going to tell you a quick story. So these are some famous e-patient advocates. And this is e-patient Dave. Give me my damn data. He's pretty cool. This is Regina Holiday. These are Americans. This guy is Salvatore Oh, I can't remember his last name, sorry. Anyway, I'm going to tell you about him. He's from Italy. So Salvatore is a young, fit, healthy guy, so he thinks not feeling so well. He's in his mid-30s, goes to the doctor after a series of tests, finds out he has a brain tumour. And like most people when they get sick, you assume, there's all the grief and all that sort of stuff, and especially no one wants to hear the word cancer. But he decides, he thinks, well, he trusts the healthcare system. And then after being in it for a little while, he realises, how come you guys aren't all talking to each other? And why are you asking me the same questions that you just asked me last time I saw you, or yesterday when I saw, your counterpart? And he soon realised about these silos that we have in healthcare. So what he decided to do was he built a website and he put every piece of information he could about his cancer, about his tumour online. And it's called Open Cure for Cancer. And he said, world, I've got a cancer, we want to try, I don't want to have cancer, I want to get rid of this tumour. What do you think is the best way for me and my doctors to help me so that I can get rid of this cancer and I can live a long, healthy life? Now, he got about, 200,000? Anyway, he got hundreds of thousands of responses. And in that, there was the people, the hippies that say, look, just eat broccoli, you'll be fine. But he also had, in amongst the broccoli guys, and broccoli's great, cheers for broccoli, don't necessarily think it'll cure cancer though. But anyway, in amongst all of that, he also had responses from neurosurgeons, from specialist cancer clinicians all around the world, from oncologists. And at one stage, he would have gone into either his GP or his treating doctor, or probably his computer, and said, oh, look, I've had a fantastic result, put this stuff online, 500,000 people, however many, I know it was a lot, of people gave me information, but I'm not medically trained. I'm an artist and I'm a social media person. You have to help me with this. How can I actually, can you help me translate all this information and work out what's the best treatment plan for me? How do you design a business model around that? How would any of you cope with that coming into your practice? And you'd probably want to help that guy. But how do you do that? And that might be an extreme example from the people doing the Dr. Google thing and coming in saying they've self-diagnosed. But as clinicians, we actually need to be engaged with our patients. But we also need to be within a business model and a system that enables us to do so. So here's some of the opportunities for disruption in healthcare. And the point of this slide is really just to say what I've been saying, is that digital innovation is fantastic and it's desperately needed, but it's not the cure-all, because you know what, doesn't matter. And if you're in the audience here, you've got the new startup that you think is really going to transform things, good luck to you. Because how are you going to connect to all the information systems that are out there? Because the computer systems that we do have throughout healthcare are closed down, they're shut, and they don't share information. And it is not in their business interest to share information with you. They're not on open API frameworks. But here's some tech companies that are doing some cool things. 23andMe, you've probably heard of them. For $99, this is American, so it's a bit more now for us, you can get a copy of your genome. Now, they're fighting with the US government at the moment, and so at the moment they'll give you your ancestral information, but once they've sorted out their legal hurdles, they'll go back to doing what they used to do, which is actually give you your full genome, actually saying what your chances are of getting Alzheimer's or other hereditary diseases. These guys are in a lot of trouble right now, but I kept them in here because see what happens with Theranos, but what they've come up with, supposedly, and that's why they're in a bit of trouble, but the idea is that from a single drop of blood, you can diagnose a bunch of conditions. So you don't have to, yeah, I saw that. Yeah, do they really? Well, it's apparently some of their stuff, and there's a whole Wall Street Journal thing about these guys right now. So they are in a bit of trouble because they can't necessarily claim that that's all true. But even if they haven't perfected it, someone else will. These guys are from Melbourne, woohoo, Melbourne. Couple of doctors who, like you, got into the healthcare system and went, what, pages, crazy. And they're like, we can do better. So they invented a company called CliniCloud. These guys have just had a $5 million funding from Tencent. Tencent is a Chinese telecommunications company who's just invested $5 million in these guys. What have they created? I've purchased one. It was part of their, I think they had a Kickstarter or something like that. It's an actual digital stethoscope and a thermometer. The first time these devices have been changed since they were invented. They've radically changed the design, and their business model isn't just to sell it to you as a doctor or as a nurse, but to sell it to me as a patient. You know, all their advertising is around mums helping the kids at home and that sort of stuff. How's that going to change things? Hexoskin, I've got one of these and I tried to get it working today and then there wasn't enough time. But this is a shirt that you wear and it's for sports, but it could be used for diagnoses and all sorts of things, that actually measures these things and you just wear it under your clothes. Smart fabric, how cool is that? The Tricorder X Prize. If you haven't heard of the Tricorder X Prize, Star Trek. In Star Trek, they have a device that they go and it would tell the doctor what's wrong with you and where your broken bones are and all that sort of stuff. There is a $10 million prize called the $10 million X Prize. They're going to announce the winners next year. This company is a finalist, and they've actually said we'll give $10 million to the company who can create the tricorder from Star Trek. I know, it sounds crazy, but there's like some fantastic technology being built as a result of this, and this is just one of them. These guys also have an app, and you're going to laugh at this one, but they reckon it's 99.7% specificity that you blow into a device that you connect to your iPhone, and it can actually diagnose 6 respiratory diseases. Now, like we'll see, you know, the jury's out yet. We'll see when they get published in academic publications. But again, if they haven't perfected it yet, someone will. So think about this, that within 5 years, the majority of clinically useful information to you as a clinician is not going to be generated within the healthcare system. It's going to be generated outside of it. And a lot of it by consumer devices. That's really exciting. Or does it completely freak you out? Or you're sort of in the middle. But that's what's going to be happening. There's a company called HealthTap. These guys, they've actually developed a system that they've just released recently, and it's a full electronic health record. They're American, Silicon Valley, that full health records. They do big data, they do analytics. They actually brag that on the iPhone app for HealthTap, you can tap it and get access to a video virtual consult with a doctor within minutes. And you could think, oh, well, I've heard that before, or people have tried that. What makes these guys different? Well, I'd be paying attention to them because these guys in New Zealand have actually just signed an agreement with them that they're going to use the HealthTap technology to actually deliver services to the million-odd people that live in that district. Something to keep an eye on. Precision medicine, another thing. There's all the wearables. And the important point that I want to make here is that, if I haven't already, is that it has to be about consumers. If you grow up thinking, yeah, I want to be a nurse, I want to be a doctor, I want to be an OT, and you stick with it because it's bloody hard, you stick with it, and then you stick with being a professional, you don't do that for the money. I mean, come on, you go do something else if you're in it for the money, you don't become a healthcare professional. You do it because you want to help people, and you want to help make the world a better place, which is a really admirable goal. So technology for technology's sake, you know, solutions looking for problems, that's not what I'm interested in either. I'm interested in solving real problems, identifying those problems, and looking at ways that we can use technology in a really great fashion to actually help consumers and to help you as clinicians. Okay? And I'm just going to skip these things because I know I'm running out of time. So I'm going to repeat 2 more quotes. Information is not necessarily an adjunct to care, it is care. This is from John Berwick again. And effective patient management requires effective management of patients' clinical data. So the idea that healthcare can work and you can be the best clinician you can be, when you have to spend 30% of your shift running around looking for information, and even then you're not going to find the best bits and the stuff that you really know when it really should be seamlessly integrated into your workflow. And again, we can have absolutely all the care we want and need if we just organise it properly.